So today I will be demonstrating the postpartum assessment of the mother. So first thing is we need to wash our hands before we enter to the room of the mother. And then we wash our hands. And then when we enter the room, we also need to introduce ourselves as the nurse of the patient and identify the name of the client, and also explain the procedure to the patient. And then we go on and wear our clean gloves in preparation for the assessment. And next thing is also we need to check for the vital sign of the patient and ask the patient if they can rate their pain from 1 to 10, 1 as the lowest and 10 as the highest. So this will determine the pain scale of the patient after birth. So we need to get their blood pressure. And then we now assess the breast of the patient. So we assess the patient or the breast of the patient if there is any engorgement or any lactation on the breast, and also if there is cracks on the areola or on the nipples around the areola. There. And next is we need to check the fundus. So we need to check the fundus every 15 minutes for the first hour, and then every 30 minutes for the next 4 hours. And then we should the fundus should be firm and on the middle of the on the midline of the abdomen. So check if it's firm. There you go. And next is we need to assess for the uterine involution of the patient by measuring it with our with fingers. So we assess with or using finger breadths. So make sure that the fundus should go down 1 finger breadth every day, and it should not be palpated anymore on the 10th day. And next, we assess for the bladder and the bowel elimination of the patient. And then, we assess for the lochia. We ask for the amount and the color of the lochia of the patient. So lochia is the discharge or the vaginal discharge that is present on a newly or after giving birth of the patient. So we categorize the amount into scanty, moderate, heavy, or the profuse. So we make sure that we note the time of changing the sanitary pads and the assess after 1 hour. And then we check for the color. So we have the rubra, serosa, and the alba. So rubra is for deep red discharge. Serosa is for the pinkish red discharge, and for the alba is for yellowish or whitish yellowish discharge. And then we need to check for the episiotomy or the laceration of the patient if for healing. So we need to check also if the laceration is healing, if there is no if there is any infection. We also need to check that. After that, we need to determine the sexual activity of the patient after giving birth. And then we evaluate for Homan's test, or the what we call the Homan's test. This will test if there is presence of thrombosis or a deep vein thrombosis to the patient. And then we assess for the emotional status or the mental health of the patient, because they may be having a postpartum depression. That is what we call it. And next is we dispose our waste properly. And now we can document the procedure that we just had.